Good morning, I'm Dr. Kerry Chant from New South Wales Health with the COVID update for Monday the 20th of December 2021. There were 2,501 cases of COVID reported in New South Wales in the 24 hours to 8 p.m. last night, and there were more than 144,000 COVID tests reported during that period. There are currently 261 COVID cases admitted to hospital, with 33 people in intensive care, 11 of whom require ventilation. Across New South Wales, we have 94.9% of people aged 16 and over have received the first dose of a COVID vaccine, and 93.4% have received 2 doses. And of the people aged 12 to 15, we have 81.5% have received a first dose and 78.1% have received 2 doses. New South Wales Health has updated its contact tracing procedures to focus on people at highest risk of acquiring COVID-19. So New South Wales Health's interviews and detailed follow-up are now focusing on places with people at high risk of severe disease, such as healthcare, aged care, disability care and correctional facilities, as well as venues where we observe high risk of transmission. Everyone should continue to monitor for COVID symptoms, and if you have COVID symptoms, get tested immediately and self-isolate until you get a negative test result. If you've told that you've had COVID-19, you will receive a text message confirming your positive test result and what you need to do next. Follow the information given to you, including who you need to tell that you are positive. This will include people you live with and people you spent more than 4 hours with in the 2 days before you got symptoms or were tested. The text message also contains a link to a short online survey you should complete, and New South Wales Health will call you if you said in that survey that you visited a high-risk setting such as a hospital, aged care or disability care facility or correctional facility. You are likely to be able to manage COVID at home if you are under 50 years of age, have had 2 doses of a COVID vaccine and do not suffer from any chronic conditions including obesity, and are not pregnant. And most children who test positive for COVID can also be safely cared for at home, even if they are not vaccinated. If you are one of these people, information is available on the New South Wales Health website on managing COVID safely at home. You will be contacted by New South Wales Health if you tell us you are pregnant or have a chronic condition. We understand a positive COVID diagnosis can cause worry. Support is available at any time if you need it, so contact your GP or call the helplines provided in the information sent to you. It is critical. Please ask for help if you need it. If you live with or spent a lot of time with a person who has COVID-19, you will be required to get tested and self-isolate for 7 days, even if you have a negative test result on that initial testing. And the reason this is so important is you can acquire the infection for up to 14 days, majority in that first 7 days. If you are a social contact of someone with COVID, please get tested and isolate until you get a negative result. It is important as we recognise that we're living with COVID, to continue to follow those safe practices. So continue to wear a mask in all indoor settings. It does significantly reduce your risk, but also importantly, it is very community minded, because it actually, if you might not necessarily know you're infectious, but can spread it to others. So again, having that, you wearing a mask and the other person wearing a mask significantly reduces risk. Get vaccinated now if you've not had your first dose, and your second dose as soon as it's due. Every day we look at the admissions to ICU, and overnight we've had several admissions to ICU, and they've mostly been unvaccinated people. So please get vaccinated. Anyone who is eligible for the booster dose should also get their booster dose now through GPs, pharmacies and New South Wales Health vaccination clinics. And then at this time of year where we are reconnecting with family and friends, our strongest advice is to choose outdoor, well-ventilated places for gatherings and limit the size of those gatherings. Use a rapid antigen test before going to an indoor gathering or event, and especially take care if you're going to be interacting with vulnerable or older people. Older people and those with underlying medical conditions should themselves take steps to protect themselves. They should limit their exposure to small social or family groups, especially those who have not yet become eligible or received the booster dose. Once again, we understand a positive COVID diagnosis can be concerning, but remember that support is available at any time if you need it, and contact your GP or call the helplines provided in the information sent to you. And please do so if you've got any concerns. Thank you.